Must avoid anti-inflammatories drug if you want more better health. Do you ever use anti-inflammatories personally? I actually took one yesterday because I have Achilles tendonitis from playing pickleball. And I took one yesterday because I have a crick in my neck and can't move it. Welcome to Health Protocol. Are anti-inflammatory medications safe? It seems like all our recent videos are about things we once thought were safe, but now maybe aren't. We're trying to grab your attention before you swipe away. If you like this video, please like it, subscribe to our channel. Today, we're discussing NSAIDs. Take 2 aspirin and call me in the morning. This phrase is such a cliché in medicine, but maybe it's time to reconsider. A lot of people really shouldn't just take aspirin. It's more of a can't live with them, can't live without them situation. Do you prescribe anti-inflammatories? Yes, I do. However, since our video with Dr. Pandey, our friend the nephrologist who basically told us we're killing all his kidneys, I've significantly cut back on prescribing them. Same here. I prescribe them for a short duration, and then I tell patients their family doctor should monitor their kidney function, blood pressure, stomach, and all the other potential issues. Sometimes, I even stop them entirely. We do that a lot, especially for post-op multimodal pain control. So, not only do we use them personally, and not only do we prescribe them, but we're going to tell you about all the potential downsides, because you need to be aware of these things if you're using them. This applies to both over-the-counter and prescription versions. Neither is completely immune to side effects. They are useful, though, and they aren't going away. We don't have many other options for pain control. We can already hear the comments. Thanks a lot. You took away my Tylenol last week, or my acetaminophen, and now you're taking away my NSAIDs this week. And with the global opioid crisis, what's left for pain control? So, they will continue to be used. I'll still use them, and I'll still prescribe them. But we absolutely have to be aware of the negative things that can happen when you use anti-inflammatory medications. Okay, so let's start at the beginning. How do they even work? Non-steroidal anti-inflammatory medications are simply anti-inflammatory medications that aren't steroids. We have steroids that can stop inflammation, like prednisone or cortisone, or things we inject. Those are powerful anti-inflammatories, but they come with a whole host of side effects and can't be used for long periods. NSAIDs are much more appealing in that sense, but they have their own problems. They work by interfering with the pathway that leads to pain and fever. Specifically, they interfere with prostaglandin synthesis by blocking chemicals called COX-1 and COX-2. Inhibiting these stops the development of prostaglandins. COX-1 is found throughout the body, while COX-2 is more induced. By blocking this pathway, we can stop these pain and fever mediators. NSAIDs aren't new, they've been around forever. Aspirin, I think, is one of the oldest medications, dating back to Hippocrates, the famous Greek physician. He discovered that the bark of a willow tree had anti-inflammatory and antipyretic, fever-reducing properties. So, chew on this bark and call me in the morning was basically Hippocrates' advice. Ancient civilizations continued to use willow bark for these properties. Then, in the 17th and 18th centuries, we started discovering the chemicals responsible for these effects. Acetyl salicylic acid, ASA, came out in the 1800s, and in 1899, Bayer, the German pharmaceutical company, trademarked it as aspirin. From then on, its use grew, though we didn't fully understand how it worked until the 1980s. Someone even won a Nobel Prize for figuring out this whole COX-1, COX-2 inhibition. Since then, we've been discovering the many uses of aspirin. Leave a comment if you use an NSAID, especially if you're part of that group who says, "I love aspirin. I grew up on aspirin. I take it all the time. It's my go-to." In the last 20 years, aspirin has leaped from just stopping pain and fever to possibly preventing cancer and offering cardiovascular benefits. There are indications that if you've had a heart attack or stroke, you might be on aspirin to reduce the chance of another. If you've had a cardiac stent, you might be on aspirin to prevent another blockage because of its antiplatelet effects, which prevent platelet aggregation. You might even be prescribed a low-dose aspirin after surgery to prevent blood clots. So, if your doctor has prescribed it, keep using it. Just be aware of the potential side effects. When it comes to NSAIDs, we'd say they're excellent for acute pain relief, controlling inflammation, and preventing secondary events after a heart attack or a stroke. However, the danger lies in taking too much, taking them for too long, or using them if you're a vulnerable individual. As we get older, accumulate chronic medical conditions, take multiple medications, or even consume alcohol or are dehydrated. These factors can increase your risk when taking even normal doses of these medications. Okay, so let's talk about the most common complications. There are 3 big systems primarily affected, though this isn't a complete list. We'll stick to the big 3. When people think about NSAIDs, what are you worried about? For me, the first thing that comes to mind is peptic ulcer disease, getting a GI bleed from your stomach because of an ulcer. This is directly correlated to NSAIDs, and chronic users have a lifetime risk of about 1 to 2%, which is not negligible. It's very real. Gastroenterologists will tell you that taking NSAIDs increases your risk of an ulcer or a GI bleed. One study found that even asymptomatic ulcers were present in 15 to 30% of regular NSAID users who underwent scoping. It's not uncommon. So, it's not just peptic ulcer disease. It can be gastritis, which is just irritation of the stomach lining, or even dyspepsia, where you experience heartburn. You can also have lower GI bleeds. If you have a friable polyp or hemorrhoids, they might bleed more because of NSAID use. Generally speaking, your GI system isn't very happy. If you talk to a gastroenterologist, their favorite amount of NSAID is usually none. I feel that if I take an anti-inflammatory for more than 2 or 3 days in a row, my stomach gets upset. So, personally, I know I can take it for 1 day and then wait a week or so before taking it again. Part of the reason for this is that COX-1 helps form mucus that lines the stomach, providing a protective barrier. Ways you can mitigate this if you have to take an NSAID for a short period of time. Consider a COX-2 specific NSAID, as this group has a drastically reduced risk of ulcers, though not zero. Take it with food. Use a low dose. If you're on an anti-inflammatory to prevent a secondary cardiovascular or cerebrovascular event, to prevent another stroke or heart attack, or because you have a stent, it's typically a low dose, like 81 milligrams. This is a subtherapeutic dose when you're thinking of pain or fever control. Since some of these effects are dose-dependent, these low doses are much safer, even if you're on them for life. Someone's going to type, "Hey, what about that headline I just saw about the possible prevention of dementia?" Oh yes, there's a scientific article that just came out. We'll give you a link to it. It looked at NSAID use and the prevention of dementia. They followed a large group of people for over a decade, dividing them into short-term, intermediate-term, or long-term users, long-term being over 2 years. They found that indeed, NSAID use did seem to decrease the incidence of dementia. This might be due to their anti-inflammatory properties and the association with inflammation in the brain. But it's an association, not causation. It's not a randomized controlled trial. It's not proven, but it may inform future studies or drugs that could help prevent dementia, because we know we need something to help prevent or treat dementia. And it might be because you're having little mini strokes. Theoretically, that's one of the possible mechanisms. Because of its platelet properties, maybe it thins your blood a bit so you're not having those little mini strokes. We don't know, but that might be one of the future uses of anti-inflammatories. These things have been around for centuries. If you're prescribed an NSAID for a specific reason, keep taking it. But just be aware, we recognize they work well. We use them, and we prescribe them. But there are risks of side effects, and we just want you to know about them so you can be aware if that's happening to you. So now you know, proceed with caution with anti-inflammatories. It's not that they don't have a role, but you need to be careful. If you like this video, please like it, subscribe to our channel. Just imagine, you can hear all this glorious information without having to look at our mugs. You are in charge of your own health. See you next time.